Hi, my name is Misty Reed, and in this video I'd like to give you a little bit of information about myself, what led me to study Chinese medicine, and eventually led me to the field of fertility. When I was in high school, I began developing severe allergies and migraines, so severe that I would go to school and actually sleep during my first period class. My family physician at the time said there was nothing he could do to help resolve these migraines except give me pain medication that would probably make me also drowsy while I was at school, he said. Even as a 17-year-old girl, I knew deep in my heart that this was just not a viable option for me. I knew that it wasn't actually solving the problem and that all it was doing was putting a band-aid on the issue. And it sounded like it was going to cause the same side effects that I was already experiencing, which was falling asleep during class. So I decided not to take the medication and decided to pursue other options. I came across a book that actually had massage points that you would use to go ahead and resolve headaches and migraines. I began to use these points on a daily basis whenever my headaches or migraines cropped up, and I was amazed at how well it worked. At that time, being a 17-year-old girl, I simply went ahead and used these massage points and kind of left it at that and didn't do any further research on the situation. However, fast forward a few years later, when I decided to go to college, the migraines came back. They were worse than they had been in high school. The allergies were worse. And at this time, I also developed debilitating pain from IBS as well. So all these things in combination led me to my doctor's office once again. It was a different doctor at this time. However, the best advice she could give me was I needed to take better care of myself. She said I needed to make sure I was sleeping enough, drinking enough water, making sure I had enough fiber in my diet, exercising, all these things, which sounded really good. But as a college student that was working part-time as well as going to school full-time, I just didn't see how I could honestly incorporate 8 hours of sleep as well as all these other requirements into my daily routine. So I began to look at other options as well. I knew that these lifestyle factors were important and they apparently were affecting my health negatively, but I was wondering what else was going on and what else I could change in my lifestyle to go ahead and help have a positive impact on my health on a daily basis. So I began to look at Chinese medicine, specifically acupuncture and Chinese herbs. What happened was I had a friend at the time that was going to Chinese medicine school and said she thought I should come in to go ahead and get my IBS symptoms treated, get them better managed, get them under control, she said. And over time, we could eventually start to work on what was actually causing them at the root level. So I went ahead and began seeing her for appointments. I began doing acupuncture every week, began taking my Chinese herbs, and within about a month, I noticed that my migraines were less severe. And as time went on, they began to diminish greatly. And to this day, I actually have a Chinese herbal formula that I use whenever these migraines crop up. That way I can go ahead and resolve them quickly. Usually within about 30 to 60 minutes of taking the herbs, the migraine is gone, which if you've ever had a migraine is pretty remarkable because a migraine can really just destroy the rest of your day, to be quite honest. So that was the first thing I noticed, was that my migraines were a lot better, and then my allergies began to get better, and of course then my IBS symptoms as well got better. So all of these things in conjunction really got me thinking. At the time, I was going to the University of Texas at Austin, and I was studying nutrition. And I was very interested in food and how it affects our body, but I wasn't really sure what I was going to do with a nutrition degree after graduation. I knew that I wanted to do something else that probably wasn't related to that field, or maybe somehow incorporating that into my work with something else. And I was thinking about massage therapy school at the time. Well, after seeing my own transformation through acupuncture and its use with food and herbs and all sorts of different things, I began to realize that maybe I could go to school for acupuncture. So after I finished up my degree of nutrition at UT, I went ahead and took a couple years off to work to go ahead and consider this, and then I eventually went to acupuncture school. Well, fast forward a few years after that, and as I got towards the end of my studies, that last year, as I was going ahead and pursuing my studies at AOMA for acupuncture and Chinese medicine, I began to think about what was I going to do when I got out into the field. What did I want to focus on? What was going to be my niche? Who did I want to treat? Who did I want to see and take care of on a daily basis? And time and again, the answer for me was women. I knew I wanted to help women. While I was going to Chinese medicine school, I realized that we can really help women a lot with painful menstrual cycles, with irregular cycles, with anovulation, with all these different things. And I really wanted to help women learn more about their bodies, help educate them a little bit better about it, about what to expect, what was normal, what was acceptable essentially, and what shouldn't be acceptable as far as their menstrual cycle goes. And then as I got closer to into my studies at AOMA, I found a clinic that I could intern in, and I was actually their herbal intern at their clinic for a year. And the clinic actually specialized in reproductive medicine, but more specifically, the bulk of their patients were infertility patients. So as I began working for them, I realized that this was a very interesting niche and it kind of combined everything that I wanted to work on. So after I graduated, I did end up working for them full time. And I worked for them for over 6 years. And I learned a lot during that time. I think some of the biggest things that I learned, however, were that it's so rarely one thing that we need to fix to really help improve someone's overall health, right? If it were as simple as it's just eating one different food or taking out one food from our diet or exercising every day, then people would probably already be doing that things. But what happens is people start a new exercise routine and they feel better for a while, but then they start feeling poor or their sleep starts suffering or somewhere along the line, their body starts to give them signals that it's not happy with what's going on, with how it's being treated on a daily basis. So I've really learned with my time in reproductive acupuncture that we really need a combination of methods, right? So we need to use diet. We need to also go ahead and use Chinese medicine from the perspective of acupuncture, Chinese herbs, how they view food in Chinese medicine, which is completely different than how we view it in Western medicine. Exercise, make sure that we're sleeping enough, that we're drinking enough water. All of these things have a huge impact on our health on a daily basis. So I'll leave you with that little bit for today. I want to keep this video short. But that's just a brief rundown of how I got interested in Chinese medicine and what brought me to the field of fertility. If you have any questions, please feel free to go ahead and shoot me an email or give me a phone call. I'd love to chat about how I can help you. And if you feel like this video might be helpful for someone else you know, please feel free to share it. Thank you and have a great day. And don't stop dreaming.